And it's Monday, February 21st. It's President's Day. I just got through having the opportunity to meet with the West Virginia Federation of Republican Women. Ladies that are doing great work, and I was excited to see them. And I think we had a wonderful meeting, and so I thank them for all the great work that they're doing every day, and proud of them in every way. Today, we've lost another 37 people in West Virginia. Those, I'll ask again for your prayers, your thoughts, your phone calls, your letters, or whatever it may be to these folks and these families and all these people's loved ones. But now we're up to 6,183 deaths in West Virginia. I'm going to give you some good information here that'll make you maybe feel a little better, or maybe a little more hope or optimism, as we go through this and everything. But we ask again that you'll stand arm in arm with these folks that we've lost and all their loved ones. The 6,147th death is a 62-year-old female from Kanawha County. The 6,148th death, an 89-year-old male from Wood County. The 6,149th death, a 63-year-old female from Randolph County. The 6,150th death, an 83-year-old male from Wood County. The 6,151st death, a 62-year-old male from Randolph County. The 6,152nd death, a 63-year-old male from Kanawha County. The 6,153rd death, an 89-year-old female from Fayette County. The 6,154th death, a 71-year-old female from Mingo County. The 6,155th death, a 55-year-old male from Lincoln County. The 6,156th death, a 74-year-old female from Raleigh County. The 6,157th death, a 67-year-old female from Kanawha County. The 6,158th death, a 57-year-old male from Ritchie County. The 6,159th death, a 90-year-old male from Wood County. The 6,160th death, an 81-year-old female from Mason County. The 6,161st death, a 65-year-old male from Marion County. The 6,162nd death, a 92-year-old female from Clay County. The 6,163rd death, a 76-year-old female from Mineral County. The 6,164th death, a 57-year-old male from Wetzel County. The 6,165th death, a 78-year-old female from Ohio County. The 6,166th death, an 85-year-old female from Greenbrier County. The 6,167th death, an 86-year-old female from Wood County. The 6,168th death, a 73-year-old male from Randolph County. The 6,169th death, a 63-year-old female from Lewis County. The 6,170th death, a 67-year-old female from Kanawha County. The 6,171st death, a 69-year-old female from Wood County. The 6,172nd death, a 90-year-old male from Raleigh County. The 6,173rd death, a 50-year-old, let me back up. The 6,172nd death is a 90-year-old male from Raleigh County. The 6,173rd death is a 50-year-old male from Mingo County. The 6,174th death is an 81-year-old male from Greenbrier County. The 6,175th death is a 71-year-old male from Kanawha County. The 6,176th death is an 83-year-old female from Raleigh County. The 6,177th death is a 75-year-old female from Marion County. The 6,178th death is a 61-year-old male from Jefferson County. The 6,179th death is an 85-year-old female from Raleigh County. The 6,180th death is a 63-year-old female from Putnam County. The 6,181st death is a 90-year-old female from Kanawha County. The 6,182nd death is an 85-year-old male from Monongahela County. And the 6,183rd death in West Virginia is a 56-year-old female from Wood County. I really hope you pick up on these. The fact that all that I read through here, there was 2, 3, 4, 5. 5 of the 37 folks that we lost here were in their 50s. Everyone else older than in their 50s. Now, really, what is all that telling us over and over and over? If you're 50 and above, and you've been vaccinated, and I'm sure a bunch of these folks were never vaccinated, but if you've been vaccinated and you're 50 and above, recognize that this disease is killing the elderly over and over and over. And please recognize, if you took the time to be vaccinated, that your vaccination, if you're 6 months out from your last shot, your vaccinations are worthless to you right now almost. Absolutely, you've got to get that booster shot. That's all there is to it. Just look at the math and look at the tea leaves and stack the deck in your favor. This is good news right here. Now, we want our active cases to be 0, but we're down from active cases in the 20,000s or approaching 30,000 down to 4,665 cases now. And that's a lot better. We did have 3,101 new positive cases in the last 24 hours, and our daily positivity rate was at 10.82. Our cumulative rate is at 8.39. We've got almost 475,000 people in West Virginia that have gotten COVID and now recovered. You know, again, we want it to be 0, but we're down from well above 1,000 to 645 people that are hospitalized now, 152 in the ICU units, and 80 that are on ventilators. We have lots and lots and lots of counties that are green now. 17 green counties and no red counties. Well, when David Doll was going, I thought, we're going to pick that up on the audio too. I'm sorry, just a couple of little technical problems here and everything, but let me jump back to our numbers just 1 second and say, our active cases are down to 4,665 from, like I said before, and I don't know if you got it, but well over 20,000 and approaching 30,000. Our new positive cases in the last 24 hours were at 3,105, and that's surely high. But daily positivity rate at 10.82 and the cumulative rate at 8.39. 475,000 right at that have now recovered from COVID of West Virginians. It's hard to believe, that that's well over a fourth of our total population has gotten COVID and recovered. 645 people are now in the hospital, and that's significantly less, and that's good. We want it to be 0, and let's just keep working at this as hard as we possibly can. 152 in the ICU units and 80 on ventilators, and we got a bunch of green counties, 17 green counties in the state now, and no red counties, and that's good. Before I go any further, though, this just took a little while, I guess, to get to me, but this was written, by a wonderful young lady. I think she's 11 years old, and drawn by her as well. Her dad is Tom Bowen, and this is her letter to me, and I'm going to read it to you. It says, Dear Governor Justice. Now just think about this. This is, again, I think she's 11 years old. I'm not sure that I've got that exactly right, but I think. But she wrote, when I heard you were sick with COVID, I made you this painting to cheer you up. I know you and your team have been working hard to keep all of us safe, and I was sad to hear that you were sick. I found this quote and thought it might make you and others feel better. Now imagine this, just imagine, and I want to double check. Yes, she is 11 years old. I found this quote and thought it might make you and others feel better. And it's in quotation marks. Never forget that with each day, as the sun rises, hope soars. I'm glad you are feeling better, and I hope everyone who is sick feels better soon. I'm glad you are feeling better, and I hope everyone who is sick feels better soon. Anna Kate Bowen. She's from Huntington, West Virginia, 11 years old, and I want you to look what she drew. It's unbelievable, unflat believable. She wrote on the back of it, the quote, never forget that with each day, as the sun rises, hope soars. It's really, 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 really amazing what the great kids of this state do, and just how good they really are, how smart and how good they really are. So from all that, and this is Anna Kate, yes, from all that, we thank you, and we thank her dad, Tom Bowen, and wonderful, wonderful family. So thanks so much, and I'll keep that forever, young lady. Keep doing the great work, and keep making all of us proud. Her dad writes this, and I want to read this to you too. I hope this note finds you well. I have enclosed a painting my daughter did for the governor when she heard he was diagnosed with COVID. She's 11 years old. She has a tremendous, and this is the part that really we should pay the most attention to, or a lot of attention to. She has a tremendous heart for others, a truly compassionate person. Please give our best to Governor Justice and his wife. And thank you, Tom Bowen. So thank all of you, especially you, Anna, and congratulations on being a real talent and being a superstar for West Virginia. Now let me jump back to to where we were, and again I want to express all my gratitude and thanks to the National Guard, 348 Guard members that are out now that are working and deployed in 38 different facilities. I remind people about the home test. You can get those right now by looking at our covidtest.gov line and ordering them. You can get 4 per household, and you can get N95 masks. If you'll go to your community health centers or pharmacies, you ought to be able to get those now. I want to tell you again about the antibodies. A bunch of them have been discontinued, but we still have antibodies that can absolutely fight this thing and everything. If we can get you tested soon enough and know that you're positive soon enough, we can probably help in every way to save your lives. I've told you about the booster shots a million times, and I don't know why in the world we don't run to get those booster shots. We still are making a little headway, day by day with our numbers. We're up to 71.3% of the total 18 and over now, and that's good stuff. All the information on our vaccine info line is up, all the free testing stuff, take advantage. Long-term care facilities outbreaks are at 158. That hadn't changed much. Church community is still at 0. That's really good. Corrections still falls at 314 inmates and 65 staff cases, and we congratulate all the people involved in corrections. Keep doing that great work. We remind you about giving blood. We absolutely have many still people that can take advantage of this renter and landlord program. We are amping it up more and more each and every day. And if you have called us and become frustrated or whatever it may be by the process, please don't give up. Please don't give up. Our people are getting better each and every day, and I know they're doing a lot of great work, but don't give up on this. Just stay the course just a little longer, and we're going to be able to get you those dollars and everything if you're a renter and or a landlord, and we can get you qualified. And we will get you qualified if it's legit, and we can get you through the system. We'll get it through real quickly as we possibly can. A Jump Start program I've told you a bunch about, $1,500. We can get more and more people back into the workforce. We're already at historic lows as far as our unemployment rate, but we can get some more, and we can get you a check for $1,500 if you're on the job for 8 straight weeks, and then hopefully you're going to be on the job for a long time to come. Now I've got a couple announcements that I want to do here real quickly, and one of them is I think we've probably let both of these out already, but one of them is in regard to the Hatfield and McCoy Trail. Tourism continues to do amazing work, and really at the end of the day, what did we do? Let's just tell it like it is. I'm just eat up with telling the truth. You had a big guy here that said we need to put a stake in the sand and make a real commitment to being proud of our own pond. And we invested hundreds of millions of dollars in the state of West Virginia. And now, lo and behold, it took off almost instantaneously. And now the return is unbelievable. Unbelievable. Just on the Hatfields and McCoy's Trail last year, they sold 95,000 trail permits. They were up in the number by 46%. All those, and the overwhelming majority of all those folks are coming in from out of state, and hopefully, some of them are, there's no question, some of them are surely being encouraged and love what they see here, maybe don't like what's going on within their home state. And lo and behold, not only do they come and spend money and do all the greatness on our trails, and tourism continues to move and explode and go better and better, but a lot of those folks end up living here. And so with all that being said, I congratulate all the people, from Secretary Ruby to Secretary Gaunch and all the different people that are putting in the licks to make all this happen. All the people that are working on these trails and so on like that, what great work they're doing and everything, and it's just great stuff. That's just plain all there is to it. And at the end of the day, if all you got to do is just follow the math. Before we got here, we had 4 consecutive years of decline about people coming into West Virginia to spend, how much money they spend in West Virginia and everything. And now it's just up and more people coming, and better. So congratulations to everyone. Just keep up the great work. And the last thing is just this, is all those folks down in the southern part of the state where these trails are and everything, let me tell you this, just to be as blunt as I know to be, the southern part of the state, in a lot of ways gets forgotten or has been forgotten, not by me. I owe my whole life to the southern part of West Virginia, And with all of that, we want to help all West Virginia prosper in every way. And the challenges in southern West Virginia have been greater. We have had an explosion of good stuff, in the eastern panhandle, in the northern part of the state, central part of the state, and everything else. And the southern part of the state is a difficult and a little bit more of a difficult struggle to get us there. But with all of that, we have to be completely committed to the King Coal Highway and the Coalfield Expressway to finish it. Finish it. That's all there is to it. And it will absolutely bridge and bring the southern part of our state right back into the flow with everybody else. It's great, great people, and I am totally committed. Nobody ever needs to question that. From the standpoint of other recreational trail grant announcements that we made, we approved $8.3 million in transportation alternative and recreational trails program grants that we put out in 29 improvement projects in 20 different counties all across West Virginia, and these include a network of recreational trails, biking, walking, sidewalks, more and more different things, that all go with it and everything. So every day we keep making it better. Every day we keep at it and just keep doing any and everything we can to make West Virginia that diamond in the rough that everybody missed. And God knows across this nation, they know it. Now, we've still got a bunch of rocks to flip in West Virginia, and we've still got a bunch of people to help in West Virginia, and we can do it. We can do it all pulling the rope together. We don't need to stand on soapboxes and, try to get attention and everything. We need to do what is best for all of us. For all of us. I'm not going to do what is best for Jim Justice. I'm not going to do what is best to get to the next office or get reelected. I am going to do what is best for West Virginia. And that's what we ought to do. From a standpoint of where we're going tomorrow, we're going back out on the road. We're going to Tucker County, and at 11 p.m. we're holding a ribbon cutting. And this is, I've said the number one project. Now, secondarily, but not very far behind, we want to do Coalfield Expressway and King Coal Highway, do we not? But the number one project in the state of West Virginia is finish Quarter H, and we got to really do that, that's for sure. It will bring a ton of people into West Virginia. So at 11 o'clock, we're doing a ribbon cutting ceremonies and the grand opening of the Blackwater Falls State Park, the lodge, the major renovation that's been done. But at 1 o'clock, we're going to be joined by Senator Capito and U.S. Congressman David McKinley and Jimmy Riston from our highways and transportation departments and everything. Secretary Riston is going to be there, and others, to announce a major new project on Quarter H. And I'll be posting all this stuff and live streaming and everything. But tomorrow, I guess we're going to be in Tucker County and doing good stuff up in Tucker County. We hope if you're around and everything and you want to come out and join us, please do so. That's all I got right now. Thank y'all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And following up with what the governor has said, certainly it is good news that we have seen the number of cases that are related to the Omicron variant of COVID-19 continue to reduce. We do know, however, that just like we see in our country, the number of deaths will likely lag that number. And that we know that in the US, when we compare the US to other countries, we are number 67 on the list of those who have gotten 2 vaccines in their citizens' arms, and number 54 in the countries that have gotten the booster vaccine in the arm of their citizens as well. And we know that this a fact of having 2 vaccines and a booster is highly protective against the Omicron variant. It is important to note that as we had asked previously to the White House, to the FDA, and to the CDC to consider an additional booster dose, that recent data from the Centers for Disease Control show that there is some loss of potency after 2 months from the booster dose, and that seems to step down again at about 4 months. And while people still are relatively protected, the protection from emergency room visit or hospitalization goes from 88% reduction in emergency room visit, 93% reduction in hospitalization within the first 2 months after a booster. And that goes down to about 68% reduction in risk of ED visit and about 72% reduced risk of hospitalization. So even though that's still very good protection, we know that having that booster freshly available for people does make a difference. And because of this data and others that have come from places like the US, and then with the extra booster dose data coming from Israel that demonstrated in Israelis over 60 years old, there was about a 3 to 4 times increased protection against hospitalization for those older Israelis, that now in the United Kingdom, they are at least projected to start offering an additional boost in the spring. And I know that the FDA and the CDC is talking about that in America, or potentially in the fall time. And the debate in the United States, apparently, according to some sources, is that a general booster shot, or is that a more selective booster shot against the variant of most impact at that point? Right now, that would be Omicron. So suffice it to say, as the governor said, we are seeing things moving in the right direction. We want to make sure, though, that our citizens, all of West Virginians, remain to be well protected. We know, again, older West Virginians are at higher risk, and those that are 3 to 4 months after your booster might be at a little bit higher risk. And we don't say that to scare people, but just to remind folks that taking appropriate precautions, particularly if you're indoors, still considering wearing a high efficiency mask if you are in that risk group, might make a good sense for you, because we want to make sure that all West Virginians make it through this part of the residual surge from the Omicron variant of COVID-19 safe and healthy, and avoid not only hospitalizations and potentially more severe disease and death, but also try to keep from getting any of the manifestations of long COVID that can cause problems for the long period of time. Thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just a couple of highlights. Vaccination efforts continue, and this weekend we did see a continued trend and movement of first doses for those over the age of 18, as well as we had a good weekend, a good solid weekend for the categories of booster shots, that third shot for those not only over 18, but the over 50 and over 65 group showed a significant upward trend in those third shots. As the governor pointed out, National Guard continues to work in over 38 facilities across the state of West Virginia, continuing to help. The other thing that we have seen is, in addition to the case numbers going down, our transmission rate number continues to move in a positive downward direction, as with our hospitalizations. As Dr. Marsh has pointed out, the significance of boosters, and also provided the leadership group today some information on some data out there related to those who have had COVID and have gotten a first dose of the vaccine, that it continues to improve their ability to ward off reinfection. So we will continue to press hard, as the governor has directed us, not just with third dose booster shots, but also continuing to get other West Virginians vaccinated. Thank you.
All right, thank you, sir. Next to Dr. Ayn Amjad, our state health officer.
Good morning. This is non-COVID related, but very important for our families and caregivers to know about. There was an infant formula recall prior to the weekend. I'm just going to read it because it's a little bit lengthy. The FDA and CDC are investigating infant illness related to products from Abbott's Sturgis facility in Michigan from September 6th, 2021 to December 18th of 2021. Parents and caregivers are urged to stop using certain Similac, Alimentum, and EleCare powdered infant formulas at the Abbott Nutrition facility in Sturgis, Michigan. There were 3 reports of Coronabacter Sakazaki infections and 1 report of Salmonella infections in infants. Some of the infants were hospitalized, and there was one reported death. Abbott did issue voluntary recalls of the powdered infant formulas. We did issue a press release prior to the weekend. The first 2 digits of the code are 22 through 37 and contain K8, SH, and Z as in zebra 2. The expiration date is April 1st, 2022 or later. Our WIC clinics across the state are aware of this, and if you bring your formulas there, you can have them replaced likely. And Abbott did issue something on their website, and you can punch in these codes as well. And I believe they will do something as well with the formulas. So just wanted to make everyone aware of that. Thanks, Jordan.
Thank you, Doctor. Secretary Bill Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Thank you for taking a moment for a question. I guess this is for the governor as an overarching thing. As we see the numbers continue to improve, at what point do we transition into a more endemic treatment of the pandemic? And maybe this is for Dr. Marsh. Dr. Marsh, do you have a demarcation line where we go from pandemic to endemic, and it's just something we have to deal with on a daily basis as we move forward, unless something medically would drastically change? Thank you.
Kenny, thanks a bunch. Dr. Marsh, I think you're a whole lot better at this than I am on this one.
Thank you, Governor, and thank you, Kenny. You know, Kenny, we are anticipating very soon coming to an important fork in the road. And as you rightly point out, we are starting to see a reduction of this most recent surge that has been induced by the Omicron variant of COVID-19, both because of the levels of immunity that we have in our country, both from the vaccination, immunization, boosting, but also from the native immunity. And if the COVID virus does not have a substantial additional set of mutations that creates a different kind of variant that is a much different kind of variant, then indeed, given the immunity that we have, and also the acceptance that I think our country has now for the impact of COVID-19 on our citizens, then presumably we will be navigating and transitioning to a more endemic sort of mode, which will take a little bit for that to navigate its way through. On the other hand, COVID virus has been very capable and resilient, and so not counting it out in case it takes a different turn and has more mutations that give us a brand new variant with new characteristics that would cause more problems for us. And the more people that are immunologically capable, as we're seeing today versus any other time in the pandemic, the more likely that we will see this start to fade from more pandemic to epidemic, occurring only in areas, not across the whole globe, to more endemic. But that's really the point we're at right now. So we will see what COVID does. But we are very hopeful that very soon we will continue to see this de-escalate so that we can, continue to move forward and getting back to the life that we are all hoping to see continue to grow.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Good morning, fellow journalists. As we headed into the fall and winter, there was a concern that this was going to be a very bad flu season. And I wanted to know if the numbers support that, or if we had a typical flu season, or maybe even a lighter one like we did last year. Thank you.
Maybe Dr. Amjad, please.
Yes, Governor. Paul, our numbers are actually lower than previous flu seasons. So it's actually a good thing. I do think that our use of hand washing and our mask use did help. We did not see the uptake of the flu vaccine as higher than previously, but the flu cases were lower than before. So that was a good thing.
All right, thanks, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. General Hoyer, I was wondering if you could give us any update on the plans for the National Guard in our hospitals. I know you said you guys were going to be giving some recommendations at the end of last week. I was wondering if there's anything new you could tell us. Thank you.
General, please.
Yeah, Charles, actually, we are still engaged with the hospitals on determining a transition point. So we don't have a specific recommendation for the governor yet on that transition. We're also going to watch the latest information related to any extensions that might be made available to the National Guard for going later in the year, and that will have an impact on our determination as well. As soon as we have that, we will get that to you. Thanks.
All right, thank you, Charles. Next to Jess Mancini with Ogden Newspapers.
Thank you for taking my question. Kind of related to that last question, General, have you seen or gotten any information from hospitals that the stress on staffing perhaps is starting to ease because of the drop in hospitalizations and the overall drop in active cases? Thank you.
Yes, Jess. So we are getting information from our liaison that works in the Joint Interagency Task Force that as numbers continue to drop, hospitals are starting to see relief in that. They have seen a number of staff come back to work who have had to deal with COVID themselves. That combined with the support from the National Guard has led to a significant feedback from hospital CEOs that the assistance that we, the state of West Virginia, under the governor's direction, has provided has been significant in helping them weather this storm, and that we are starting to trend in the correct direction. Thank you.
All right, thank you, Jess. Governor, I'll turn it back to you.
Okay, I always try to make notes and everything. I'm just looking at them real quickly and everything. But, Dr. Marsh, I think, did a great job answering the question as far as moving from a pandemic to an endemic. And wouldn't that be wonderful? I mean, in all honesty, wouldn't it be wonderful if we could really start pulling out of this? And wouldn't it be wonderful if we could take Anna's words, and in regard to the sun and as hope soars and everything, and absolutely, wouldn't it just be wonderful that we have brighter days coming in West Virginia? We know we're going to get through this. We're just too tough to not get through it. But with all of that, it's been a long 2 years, has it not? And then the question about the flu season, there has been, I guess, a lot of precautions, a lot of things, people, just awareness and everything that people, are doing a little bit better. But it's good to hear that Dr. Amjad is reporting that the number of cases in our flu season are down, and that's good stuff too. So really, at the end of the day, that's all I've got. you know, I just would ask everyone, you know, to try to be prudent, try to take the proper precautions, but live life. I mean, God has given us another incredible day. And that day that he's given us is truly a gift. So live life and enjoy. Don't let anybody steal your joy. And so we're going to get through it, West Virginia. I'm really proud of all of you. Thank you.